Hi, welcome to my channel. I'm doing another cirrhosis video. I'm not ready for a video. But I saw a couple videos this morning that kind of made me mad because either they were lies or they were just part of the story. And so here I am doing another one. And let me start off by saying I am not a doctor. I am just someone living with cirrhosis and trying to help people understand it better. The whole story. And in this video, I'm going to cover because my other videos, I've told my story on how I got sick and how I found out and how I'm doing. And this one, I'm going to say the different things that can cause cirrhosis, the signs and symptoms of having cirrhosis, and the possible complications from it. And I don't know. I just feel like I need to do this because some of the videos out there are just so misleading. So start off, alcohol is what people consider the cause of cirrhosis, which that might have been the case years ago, that was the number one cause of people having cirrhosis or needing transplants. But that's not the case anymore. Then it was hepatitis C was the main cause of cirrhosis and needing the transplant. Now it's NASH, non-alcoholic fatty liver disease. So those are the top three that cause cirrhosis on this list: alcohol, hepatitis, B, C, or D, or non-alcoholic fatty liver disease. And there's also an iron buildup. And I'm not going to use technical terms because I'm not a doctor. I'm using the terms that we use in our cirrhosis groups. Cystic fibrosis can cause cirrhosis. And copper accumulation in the liver, which that is called Wilson's disease. Poorly formed bile duct. Alpha-1 something deficiency. Inherited disorders such as sugar metabolism. Genetic disorder. Liver disease caused by the own body's immune system, and that is autoimmune hepatitis. It's different from the other hepatitis because this is not contagious. This is the own body attacking itself. And destruction of the bile duct, hardening or scarring of the bile duct, infections such as syphilis, and some medications can also cause cirrhosis. And mine, like I've said before, mine was from lean NASH. And some of the symptoms, signs and symptoms that can occur, you know, everybody's different. You won't get them all, or you could get them all, or, it's just how your body reacts to it. And the first one on the list is fatigue. And that's the first one I had. I told my doctor it was like it took all of my energy just to keep my eyes open. And on those days, I rest. On the other days when it's not that bad, then I will take a walk or do something to get busy, and that can kind of wake me up. Easy bleeding and bruising, I have that. It all depends on where my platelets are, or my INR and PT. Those are your clotting factors. Sometimes are worse than others. I do make sure I keep Band-Aids with me, though. Loss of appetite. I've heard some people say they get that. Mine is more of, I can't eat as much as I used to. After a few bites, I'm full. So I try to eat several small meals a day. And I do know there is someone on YouTube that recommends intermediate fasting. No. Fasting for a cirrhosis patient is not good. because we're already so prone to being malnourished. So why risk hurting yourself? You don't need to fast if you have cirrhosis. Nausea. I have that. I keep my Zofran handy. Swelling in the legs, feet, and ankles, which that's usually fluid buildup. I don't have any of that. Weight loss. I had that in the beginning, but then I put some on. Not much. And somebody said that they heard that if you have a fatty liver, that you can't lose weight. I don't see to where that's true, because mine's from NASH, fatty liver, and I lost weight. I don't understand where that's from. Itchy skin, I don't have that. That is because your liver's not filtering out the toxins the way it should, and so it's got to find a way out of your body, and that's the skin. And so sometimes it'll cause itchy skin. Sometimes you can get jaundice, yellow skin, or the skin or the eyes. And I don't have jaundice, never have. I will say that after I found out I had cirrhosis, as soon as I'd wake up for like the first 2 months, every morning I'd wake up and go check in the mirror. I was terrified of that. Fluid accumulation in the abdomen. Ascites. I don't have that. They thought I did a couple times when my stomach swelled, but I don't. Spider-like blood vessels on your skin. Spider angiomas, I think. And I have those. I hope you can see them right here. And I got some going on to my shoulders and stuff. But they're just there. They don't itch. They don't cause any problems at all. Redness in the palm of your hands. I don't really have that. That's from laying my hands on the table. For women, absent or loss of period. For men, loss of sex drive or breast enlargement. And that's because, again, your liver's not filtering the way it should. And in women, they can get excess estrogen, and men, they can get excess testosterone. Confusion, drowsiness, slurred speech. In our cirrhosis group, we call that HE. And I don't have that, haven't had it. But if you have cirrhosis or know someone who does, it is very important that if you see them not themselves or confused or slurred speech, you get them checked out, get their blood levels checked, because that's your liver's not filtering, and you can get ammonia poisoning in the brain. So, and that can be very dangerous. So it's important to keep an eye on that one. I think even on that one, I've heard a couple people say their problem was anger. You know, they just got angry. And so, and also, and it's not on this list that I got, but varices. Some people find out they have cirrhosis from bleeding varices in their esophagus, which I've had those. I get mine checked every now and then. They've had to band them once, and most people don't even know they had it done. I did. It was painful. And now I'm getting them checked every now and then, and while they're in there, the varices aren't that bad. They will go in and stretch my esophagus, because I do have a small esophagus, and I'm hoping that if they get that stretched the way it needs to be, that if they have to band again, it won't hurt. So on this one, like varices, 90% of the people that have cirrhosis can get varices, do get varices. HE, like 70% of cirrhosis patients get that. So, and how you can help yourself if you have cirrhosis. 1, if you drink, stop. 2, diet. You want to eat as fresh as possible. I do know that you need protein if you got, okay. Some doctors are different. Some doctors say limit protein, some say don't. But if I don't have enough protein, I'm no good. Have no energy. And there is a complication of muscle wasting with cirrhosis. And protein helps prevent that. But it's got to be healthy protein. Like red meat isn't good because it's fatty. And that's part of why some people get HE is too much red meat. So, I mean, there's several other ways to get protein. Chicken, fish, it's all fine. Don't eat raw meat. Don't eat sushi. That's not good for you if you have cirrhosis. Limit your salt. Limit your sugar. Try not to eat processed foods. Try not to eat out at restaurants. If you have to, try to eat healthy. But for me, it's kind of easy because I'm a vegetarian. And I'm OCD about food. So I'd rather cook everything myself. Okay, exercise. Exercise is important. Especially, I think it helps, gives you more energy, and it just helps. And like I've said in the other 2 videos I did, cirrhosis is not a death sentence. It does not have to be. And I get so sad when I see people come into the groups or comment on one of my videos about how they feel like it's a death sentence, because it's not. And I wish doctors would help patients realize that. And I mean, because they use the phrases end of life stage or end stage liver disease, and positive attitude is a big deal with this disease. I mean, a positive attitude is important with everything. Okay. So, complications that can happen from having cirrhosis and portal hypertension, but I think that's what causes the varices, because from the scar tissue buildup, your main vein in your liver is constricted, so your blood can't get through the liver, so it's got to find other ways to get back to the heart, and it gets backed up in different places, especially the stomach, the esophagus, and they get ballooned out because they get full. And and varices, if you have one bust, it can be very dangerous. Like I said, I don't trust the hospital here to deal with it, and my doctor is 3.5, 4 hours away. So we've got a plan in case I do have a varices bleed. My husband is to tell them to knock me out. And there is a balloon that they can put down in there, in your esophagus, to put pressure on where it's bleeding, to stop the bleeding until they can repair it. So he is to tell them to knock me out. They can balloon me and get a hold of my doctors that are up north, and get me up there. That's our plan. Okay, and we've already talked about the swelling of the legs and abdomen, and that's fluid buildup. And if you get that on your abdomen, they can drain it. Enlargement of the spleen. I have that. My spleen's huge. I think that's why I feel like my stomach is so big, is because, my liver and spleen are both enlarged. And so some days I just feel like a blimp. And we've already talked about bleeding. Infection. If you have cirrhosis, you're prone to get infection. So, like, if you have cirrhosis and you get a cut, keep it clean. Keep, triple antibiotic on it. Try to keep it from getting infected. And like with diabetes, take care of your feet so you don't get an infection there. But, even bladder infection, sinus infections, tooth, you're just prone to infection because, like, I am. Because, like, my white blood cell count runs 1 point something, and that's low. And I have gotten updated on all my vaccines, my hepatitis, my flu, my pneumonia. I got updated on all of them. Malnutrition. I discussed that. And that's why you should not fast when you have cirrhosis, because we're prone to malnutrition, low vitamin levels. Like, I have a problem with my potassium going low. Dangerously low. And my body, I listened to it. And I was eating sweet potatoes and avocados and bananas and pistachios and it's stuff my body was craving. My potassium should have been normal. And it wasn't. It was dangerously low. And the potassium pills make me really sick. So I figured out, for me, I'm not recommending this, low sodium V8 has a lot of potassium. I drink 1 long glass of them a day, and my potassium levels are normal now. But that worked for me, and it brought it up like within a week. And I talked about the buildup of toxin, jaundice. And some people with cirrhosis can end up with bone disease. That's loss of bone strength and are greater risk for fractures. Which I just found this out today. So I had no idea on that one. But I think that goes back to the malnutrition part. And this one is a big one. Risk, you got a lot higher risk of liver cancer. Because there's so much going on in your liver. And you do have, like, the liver can regenerate itself. It can fix itself up to a certain point. And even though you got cirrhosis, your liver is still in there trying to fix it. And you can get these, that shows up on the MRIs or the CAT scans, these reoccurring nodules. And that's the liver trying to fix itself. And it can't. So I get a scan every 6 months to a year. MRI. He likes to alternate MRI to CAT scan. And some people, if they're really sick with their cirrhosis, they can end up with multi-organ failure, which that's like the later stage, Because once you get diagnosed, because I've heard people say, I'm stage 4 cirrhosis. Once you've gotten to cirrhosis, which there are 4 stages of your liver building up to cirrhosis. But once you have cirrhosis, you have cirrhosis. It's either compensated or decompensated. Compensated means you have cirrhosis, but what part of your liver works is working good. Decompensated means your liver's not working the way it should at all. you know, it's really sick. I'm compensated. Means what part of my liver is working fine. And another thing, common sign of cirrhosis is being cold. Some people are cold, some people are hot, which I don't understand the hot one. I'm always cold. I can freeze in 80-degree weather. But that's because your liver is your heater. Your body's heater. And if your blood can't get through the liver because of portal hypertension, it's not getting heated up the way it should. So I freeze and I'm cold all the time. And I guess that's it. I got it in one video. But like if you do have cirrhosis, it's very important to talk to your doctor. You know, Dr. Google is not a good thing. You have a doctor for a reason. Talk to him. If you have questions, talk to him. Because you can go into a cirrhosis group on Facebook and ask a question and get 20 different answers. Because either that's what they read off Dr. Google or that's what their doctor told them. I don't know. And like I said in the beginning, I am not a doctor. I'm just telling you what I know about cirrhosis. And so it's important to talk to your doctor, to have a good relationship with them and their nurses. It's important to ask the questions that you have to your doctor. It's important to listen to your doctor, but it's also important for your doctor to listen to you. And if your doctor's not giving you hope, if you don't have a good doctor that is giving you hope that this is not a death sentence, find a new doctor. Because it's not a death sentence. It really isn't. And if you have a doctor that has no hope, then how are you supposed to have hope? The most important thing you can have in this is a good support system and a good relationship with your doctor and a positive attitude. But when the doctor orders tests, your blood work, that should be done every 6 months to a year. Your scans, that should be done every 6 months to a year. Biopsy, I had that. I had the fibroscan. When they want to do the scope to check for varices, it's important to get that done. Because the last thing you want is a varice bleed. But I will say that varices can show up on your MRIs and stuff. So you might know you have varices before they ever do the scope. I did. That's how I found out I had them. It was an MRI I had. And it's also, and like I said earlier, that your support system, that's important. I have a good one most of the time. My family loves me. They would do anything for me. My family's and friends. My problem is my husband doesn't want me to talk about me having cirrhosis. He said if anybody can beat it, I can. You can't beat cirrhosis. You can live with cirrhosis. And that's what I'm doing. I'm living with it. And I don't think he's fully acknowledged yet that I'm sick. I think my next video, because I've talked so much about my life with cirrhosis, I think my next video, I'm going to get somebody else from the cirrhosis group and have them do a video with me so they can talk about their life with cirrhosis. I also think I want to get one of the members of one of the groups that's a caregiver for somebody that has cirrhosis and have them talk about what it's like taking care of somebody with cirrhosis. But I will say, if I ever hear my husband calling himself my caregiver, I will be mad, because I'm not there yet. I hope I don't end up there to where I feel like I need a caregiver. But those are my ideas for my next 2 videos. And I will do them before a year. I promise. Just let me get a hold of. I'll try to do them in the next couple weeks. Thanks for listening. I just had to get all this off my chest because there's so much misinformation out there on YouTube that it just kind of made me mad. So I had to get on here and, I don't know, set the record straight. Thanks for listening. Have a great day. Bye.